Mr. Bennett, you've come in today for a colonoscopic examination or an endoscopic exam of the entire bowel. As you know, you have low-grade inflammatory bowel disease. As you see here on the X-ray,
colonoscopy is a procedure your doctor may use to help evaluate the condition of your colon, or large bowel.
you have prepared yourself.
This procedure is more precise than an X-ray and involves less risk, discomfort, and inconvenience than surgery.
Wake up, you should feel fine, except for maybe some mild.
The digestive tract is the system through which your body takes in food and gets rid of wastes. The lower digestive tract consists of two major sections: the colon, or large bowel, where body wastes accumulate, and the rectum, which provides a route for the wastes to leave your body. Common problems with the lower digestive tract include persistent diarrhea, bleeding, inflammatory bowel disease, unexplained pain, polyps, which are small, normally non-cancerous growths, and cancer. Colonoscopy is an excellent screening procedure for cancer of the colon. In order to view the lower intestinal tract, your doctor will use a device called a colonoscope. The colonoscope uses bundles of extremely thin and flexible glass fibers, called fiber optics, to illuminate the interior of the colon. When the tube of the scope is guided through your colon, your doctor will be able to inspect all the parts of the large bowel and the lower portion of the small bowel in detail. Its control allows the tip of the scope to be turned in any direction to aid in the examination. The risks involved in a colonoscopy are minimal. The first is perforation, which is very unlikely to occur. There is also a slight risk of hemorrhage if a very large biopsy from the bowel is taken. Because certain drugs will be used during the exam, it is important to tell your doctor of any known allergies or reaction to drugs you might have.
Now, you've already gotten prepared, which is the hardest part of the procedure.
Before the exam, it is important to completely empty your bowel of stool. The reason is simple. The colonoscope cannot see through stool. So if your bowel is not clean, your doctor will not be able to carry out the examination. Cleansing preparations may differ depending on your doctor's preference. Generally, they will include a specific diet to follow a few days before the exam, a prescribed routine of laxatives and/or enemas, or you'll be instructed to drink a solution which will cleanse the bowel. And in almost all cases, you will be instructed to eat or drink nothing 8 to 10 hours before the exam. In most instances, the colonoscopy exam takes place at a hospital. However, some doctors are equipped to give the exam in their offices.
Now, are you relatively comfortable?
Yeah, I'm fine. Okay.
And just to reconfirm, you don't have any allergies to any medications?
Okay, slow this down now. Watch out for your hand, please. I'll give you some drugs first. It'll help you go to sleep.
Medication given through an intravenous needle, or IV, will keep you relaxed and sleepy throughout the exam. But you will remain conscious and able to speak.
I just want to make sure you're comfortable.
As the lubricated tip of the scope is inserted into the rectum, a flow of air inflates the passage and keeps it open for clear viewing, as your doctor carefully guides the tube through the bowel. The medication will keep you from feeling much of the scope's movement.
A little bit of pressure, sir.
However, it's important that you communicate any discomfort you do feel to your doctor. If your doctor should locate a small growth called a polyp, a wire snare can be placed around its base. The polyp can be severed and retrieved for lab analysis. This is called a polypectomy, a painless and safe procedure during colonoscopy. If a growth or malignancy is found, A tissue sample can be taken and sent to the lab for evaluation. This will allow your doctor to proceed with the appropriate therapy as soon as possible. If the growth is cancer, early detection means a better chance of total cure. After the colonoscope is removed, you'll be taken to a recovery area or back to your room to allow time for most of the sedative to wear off.
Mr. Bennett?
Van, move over, sir.
Mr. Bennett, we're done.
We'll get Dr. Milligan to come in and speak with you, and then we'll get you up and get you dressed, okay?
You'll feel a bit groggy for the next 8 to 12 hours, so driving yourself home will be unsafe. Therefore, it's best to make arrangements for someone to take you home. There are some minor side effects which you may experience after the colonoscopy exam. Mild cramps, gas, and possibly a small spotting of blood in the stool. Normally, all of these side effects will disappear within 24 hours. If these side effects persist or become more severe, call your doctor. In a few days, your doctor will contact you to discuss the results of the exam.
Mr. Bennett, I have good news for you. Your colonoscopic examination showed no evidence of any serious disease.
As a diagnostic and therapeutic tool, colonoscopy is a safe and useful procedure, one in which you should have the utmost confidence.
I'll see you back in 6 months' time for a follow-up, and everything should be fine. Okay?
See you then.
Good.